Question 6. The nurse is teaching a patient with multiple sclerosis how to manage heat sensitivity. Which statement shows that the patient understands the teaching? The correct answer is C. I'll use cooling vests and stay in air conditioned areas. Why is heat such a concern in MS? Remember the pathophysiology. MS causes demyelination, meaning the protective myelin around the nerves has been damaged. Those damaged nerves already have difficulty conducting electrical signals. When the patient's body temperature increases, even slightly, nerve conduction through those demyelinated pathways can become temporarily worse. This is called Udhoff phenomenon. The patient may notice temporary worsening of symptoms, such as blurred vision, weakness, fatigue, numbness, or difficulty walking. This does not necessarily mean the MS itself is permanently getting worse. The symptoms may improve when the patient's temperature returns to normal. Now look at the incorrect choices. A hot tub increases body temperature. Exercising outside during a hot afternoon can increase body temperature. And a sauna intentionally raises body temperature. All three can worsen MS symptoms. So remember, MS plus heat equals symptoms increase. Cooling strategies such as air conditioning, fans, cooling garments, cool showers, hydration, and avoiding excessive heat exposure can help. Now let's move to question 7. A patient with MS is experiencing extreme fatigue. What is the priority nursing intervention? The correct answer is B. Schedule frequent rest periods. Fatigue is one of the most common and disabling symptoms of MS. But telling the patient to stay in bed all day is not the goal. We want energy conservation with appropriate activity. Teach the patient to plan important activities during the time of day when energy is highest. Break large activities into smaller tasks and schedule rest periods before becoming completely exhausted. Think activity, rest, activity, rest. Why aren't energy drinks the answer? Stimulant-containing drinks may interfere with sleep and do not address the underlying neurological fatigue. And we don't automatically increase corticosteroids simply because the patient is tired. Corticosteroids are primarily used for significant acute MS relapses, not routine fatigue management. Clinical judgment connection. Here is how I want you to connect these two questions. A patient tells you, "Every time I take a very hot shower, my legs become weaker and my vision gets blurry." Don't immediately assume the patient is experiencing a new MS relapse. Ask, did the symptoms appear with increased body temperature, and do they improve after cooling? That pattern suggests heat-related temporary worsening of MS symptoms. Now imagine another patient says, "By lunchtime, I'm so exhausted that I cannot finish my normal activities." Your first nursing strategy is not simply medication. Think energy conservation. Schedule demanding activities when the patient has the most energy.